Well, welcome back, everyone, for another very exciting version of our monthly policy forum. Also, of course, welcome back to Jen, who is back with us after traveling last month. We're going to take some time today to go over the current status of the FASD Respect Act. We'll talk about some recent meetings we've had, what's going on in the disability policy space as a whole. Before any of that, though, I'm going to throw it right over to Jen for some organization updates.
Yeah, so Tom's on holidays today, so I'll go ahead and provide uh, some updates on what's going on at FASD United. Big thing is we are prepping for FASD Awareness Month. If you move it on to the next screen there, Chris, we will have a suite of resources available by June 15th. A lot of you have noticed our Give FASD a Seat at the Table images and branding that we're using this year. Those are available without the FASD United logo on them if you'd like to adopt them and use them as your own. And our FASD Awareness Month resources is going to contain a kit of social media tiles and slides, information on ways to interact with local politicians, infographics, all kinds of stuff that you can use in planning and celebrating FASD Awareness Month in your neck of the woods. So I encourage you to keep an eye on the website and check that out. And then also on the website, we do have a suite currently of all of the seat at the table materials. And if there's anything that you don't see there that you'd like, or anything that you'd like to have unbranded, just let us know. We're happy to provide that for you. The goal is to get the seat at the table for FASD wherever those seats are needed. And these materials are meant to help with that. So however you can use them, please feel free to do so. Speaking of coming up into FASD Awareness Month, I'll have Emma give us a little bit of information on Impact Week coming up, but I did want to mention on our next slide that the affiliate network is consistently growing and getting bigger and stronger and collaborating together. And they just did a really phenomenal session on code switching and masking and how that relates to FASD and how we can include more people in our conversations, give more seats to the table by knowing how people work and knowing how best to support them and knowing how to keep our minds open to new possibilities. So it was a really great session done there. And if you are an affiliate, I just want to remind you that the monthly affiliate meeting is coming up. That always happens on I believe, the third Thursday of the month. So that would be coming up on Thursday, May 20th. And if you are not receiving invitations to attend, please let me know because we want to make sure that all of our affiliates are getting the information to be able to attend. And if you would like information on becoming an affiliate, again, please let me know. Our affiliate organizations are state agencies, nonprofits, universities. They span a huge gamut of types of organizations. And so we really invite you to take a look at that. So, like I said, Impact Week is coming up in September. So I'll pass that on over to Emma to talk about.
Hi, everybody. Thank you for having me. Um, I'm very excited about this year's Impact Week. I've been a really big fan of our Seat at the Table campaign and the ways that's going to play into Advocacy Week and Impact Week. So there's 3 days of programming. The first day being a symposium style where participants will be kind of treated as the experts and will be working on creating shared language around a problem in the FASD community and finding solutions together. So hopefully that will be really engaging programming that day. Later that night, that evening, is the Red Shoes Gala, which is my biggest project. So I hope to see you all there, or hope that you will invite, friends or champions in the community to attend. That's our biggest fundraiser of the year. And I could go on about the importance of building our unrestricted funding, and especially in the policy space and being able to do our policy work. And then the next day is the policy day, the Hill Day. Tuesday, Chris is hard at work with anybody who's registering, making sure that they get a meeting with their legislator. So hopefully, if you're in DC, we can make that happen. That's just a really cool experience to see the FASD community show up at the national capitol and speak confidently about their living experience, their professional experience in advocating for the Respect Act. And then the next day, our partners at the Department of Defense have a day of programming, of workshops, and we know that they're aiming to make it really engaging. That was the feedback they got last year, was make it interactive for the FASD community where we so rarely get to be together in person. It will be a kind of continuing of centering that connection and talking to each other. But that is Impact Week. I know we have more description of that on the website. So please go check that out and register. I will note that the gala is another registration. So Impact Week is free. If you show up in DC and you're in the area and you register beforehand, we'll be ready for you. We'll have your packet of materials and everything. The gala though is another registration. So make sure that if you want to attend both, that you cover both of those bases, and all of those are linked to the registration website.
Awesome. Thank you, Emma. I'm going to have you talk about Run Fast in just a second, but before that, I just want to let everyone know who's already registered for Impact Week, in particularly Hill Day. You should expect an email from me tomorrow and Friday to get started on setting up your meetings. We are specifically reaching out early, asking for meetings with legislators in order to have the biggest impact that we can possibly have. And just a note on the Red Shoes Gala, it's such a great experience. I've really enjoyed it, even working it for the last 2 years. It seems like such a DC type event, being at the press club. It's just really great. And if you're interested in policy at all, last year, Emma, correct me if I'm wrong, I think we had Representative Trone in attendance, and you and I also got to meet Klobuchar, which is a pretty cool experience.
And a big shout out to Gita Brown for being the first person to sign up for
Yeah,
Impact Week this year.
Great to see you virtually. And
Also,
congrats on being our first registrant.
Yeah. Carl, thank you for posting the links. You're doing great work.
Awesome. And Run Fast is another one of our annual events that we're continuing again this year, and only a little bit differently, but I want to share how that impacts the event this year. So Run Fast is our virtual 5K where you can run, walk, roll, whatever, wherever you are. And we hope that people will not just run, walk, roll wherever they are, but invite people from their community in to do that with them. That you'll find somewhere to go in your local community and invite your friends and family to join, or whatever community involvement, the ways you can get people involved. This year, we have an option for our affiliates. So if any affiliates are in the audience right now, an option for affiliates to set up themselves as a fundraiser for Run Fast. So people will register for the 5K, they can participate, and when they choose to donate, they would have, us as an option, of course, like it's always been. But this year, we also have participating affiliates are able to kind of put their name in and get donations that way. So because of that, we have fewer sponsors who are not FASD United affiliates. So not only are we hoping people register June 1st, but we're hoping to find some new sponsors. And if you know small businesses, organizations who might be willing to support in that way, sponsorships are pretty low level. They're 250 to 1,000, whereas the gala sponsors tend to be pretty high dollar amounts. If you know an organization that you want to just start getting involved in these kinds of things, this could be a good event to just start getting them involved and get them a little bit more information and plugged in. So if you're an affiliate and want to use this as an opportunity to fundraise, absolutely reach out to me. And if you know of any organization that wants to sponsor, absolutely reach out to me. And if you want to register, you're welcome to reach out to me, but that you should register online after June 1st when registration opens. And thank you, Jen, for sending my email. in the chat. And I don't know if anybody has questions about our Awareness Month activities and all the events going on, but I'd be happy to give it my best shot. Okay. All right. Well,
Awesome.
thank you.
Thank you so much, Emma. Yeah, I'll be doing the non-traditional run this year. I think I'll be biking it. I've joined a few different bike groups around DC, and I always take the opportunity to wear my Run Fast shirt from last year or the Hill Day shirt from last year that says "Ask Me About FASD," and it's led to some really great conversations within those groups, including one just over the weekend with a cardiologist who was kind of shocked to hear about the work we were doing in our space. So I was really happy to be able to have that conversation. Moving on to some policy related content. I see a few names on the participant list that I don't recognize. So I definitely want to run through what the FASD Respect Act 2.0 is, what it involves, and where we're at in the process. So this iteration of the Respect Act was introduced in June of last year by Senators Murkowski and Klobuchar and Representatives Bacon McCollum. It, at its core, reauthorizes programs for education and awareness and services across federal agencies, programming that has authorization expired several years ago. It will allow for the building of state and tribal systems that work with FASD and would critically reestablish centers for excellence. For any of you who were involved during the 117th Congress and are just now jumping back in during the 118th Congress, this bill is significantly shorter. It's condensed. It took priority language that was developed with the Senate Help Committee during the 117th and made that into the bill language. And it does not prescribe any dollar amounts to funding. So now we can look at everyone's favorite bouncing chair, which, as I'm sure we're all aware, has kind of been on step 6 here for a few months now. But I don't think that's any reason to be discouraged. We're feeling that we're confident and in a good place. So just to run through this again for anyone who's new or anyone who's forgotten, the bill has been included in the Support Reauthorization Act. That is the bill that, if you were on this a little early, Jen was talking about. She just got a ping for. This Support Reauthorization Act has made its way through the Senate Help Committee, which is the Health, Labor, and Education and Pensions Committee. And this is the furthest an FASD bill has progressed federally in the last 20 years. We've been counseled by bill authors that the Support Act will most likely be considered and most likely / hopefully passed during the lame duck session. For anyone who's not aware, the lame duck session is the period between the actual election, but before the next term starts. As we have seen in recent years, it's really hard for standalone small bills to be passed or even brought to the floor. So being included in the Senate Support Act is fantastic. We're happy with how that's positioned, and it's relevant to the Support Act as well. Our bill, the FAC Respect Act, was not included in the House version. The House version had already passed prior to our inclusion on the Senate side. This just means that once the Support Act passes through the full Senate, the House and Senate leadership will get together in conference and resolve any differences between the two bills. This is why it is critically important to keep talking about this bill with our legislators, specifically in the House. We need to show that there's popular support for the FASD Respect Act. So it's kept in there. It's kept in that final version of the bill. As you can see down on the bottom of this slide, the 118th Congress lasts for 2 years and will be coming to a close this December 2024. So while we're not out of time, there is an unlimited time, and a lot of people have put in a lot of very hard work in this process, including everyone that's on this call right now. So it's really important, and this is what we're doing here internally, is a big policy push, making sure that we can be best positioned to get this bill passed by the end of the year, because I don't think anyone is super interested in starting the process over. On that note, we can talk about the meetings. What has gone on in May? It was a busy month for meetings, specifically thanks to the Texas group. As you can see here, we had many meetings with representatives from Texas. I had one meeting with a representative from Rhode Island, and Jen was able to meet with Senator Cantwell from her state of Washington. These are more meetings than we had in the month of April, yet we've not seen the fruit of these labors yet. I'm really hoping in June to be able to put out just blog post after blog post of incoming co-sponsors and everything like that. Some of these meetings were held with pretty key players on different committees. Representative Gonzalez sits on the House Appropriations Committee. Representative Weber sits on the Committee of Energy and Commerce in the House, which includes the Health Subcommittee. And Representative Granger is the outgoing chairwoman of the Appropriations Committee. As you can see, we're sitting at 51 co-sponsors in the House and 11 in the Senate. So we've already surpassed the amount of co-sponsors we had in the Senate during the 117th Congress, and we are ahead of where we were at this point during the 117th. I say that just to show everyone that we're heading in the right direction, that there's been so much great work done on this. But we're not in a place where we can really just sit and rest at this point. So I know internally, at least, we're really pushing for a lot more meetings, specifically in the coming months. Jen, is there anything you wanted to add about the meeting you sat in on with Senator Cantwell?
Well, I think it was just a good reminder to me that if you are doing meetings with other people, to do a coaching call beforehand, or do a practice call beforehand, and we're happy to facilitate those. Um, Sometimes there's an urge when you're meeting with a legislator and you feel so passionately about this to talk about, well, I'm your voter, I'm your constituent, I want to hear from you, and kind of demand a little bit from your legislator. And unfortunately, what you see in the staffers, depending on how that approach is done, is you kind of see them shut down and turn off. And so it's important that, do we want this as a venting session, or do we want this to be able to move things forward, right? Both are valid feelings, both are valid things to say and feel, but do we want success in this, or do we want to just be heard? And so I think it just kind of reiterated that a practice call is always a good thing, and making sure that the people that are speaking have the words to be able to use to put their passion and their caring and their hope for a better future into actionable items that the legislator can do. So, and if you need help with that, if you don't feel like I have that down myself, this is where Chris comes in, right? This is where I come in. This is where FASD United comes in. We want to help you build that language. And even our family navigators can maybe help with relieving some of that pressure. But it is very, it's a very passionate, emotional thing to talk to your legislator about the FASD Respect Act, and to talk to them about something that touches most of us so deeply. So it does get emotional, and just making sure that we use that emotion in a way that is going to help accomplish something, and get things done, is just a piece of advice or a thought that I've had
Yeah,
recently.
I
And
think
then
that's
just making sure you have backup documents ready to go. So as soon as you get off that call, send them articles pertinent to what you talked about, or if they asked questions, can you send them some more information on that? And not 5 or 6 items, 1 or 2 items, because they have very limited time and they're not going to read it all. So, and we've got a lot of those resources on the For Staffers page um, on the policy website. So we update those pretty regularly.
Yeah, I'm glad you mentioned that. Joel, I'll get you in just one second. Thank you so much for raising your hand. I'm glad you mentioned just the follow-up, because it's not just like the language coaching or anything like that we're happy to do. We're happy to walk you through any research studies, anything that might be relevant that you want to talk about, just to give you the confidence to go in there and be able to say what you want to say and not have to worry about anything. Jen, I think when we were talking about this specific thing, we called it efficacy through etiquette. So we'd always happy to have these practice calls, little briefs before. I know that some of the groups like to stay on after calls and they do a debrief, which I think is just also a really, really fantastic thing to do. Um,
And an underutilized resource. Sorry, Joel. I'm getting to your question, I swear. But we do have the Department of Defense through Uniformed Services University Health Sciences does a report annually of that workshop that they do during Impact Week, kind of the state of FASD. And if you can find a legislator that says they don't care about the U.S. military, good luck. So if you're talking to them and you're talking about, even the US military is looking at FASD among military healthcare beneficiaries, and you should see some of the work that they're doing. That's another way you can touch them and something that you can send to them that highlights, hey, there is an important need here. So, and we'll have that available either as an email copy, or preferably we have hard copies that Chris can run up to the Hill and drop off if that makes it even easier. So sorry, Joel, your question?
Well, you may have answered a little bit of that, but when Chris and I were on a call with uh, Congressman Emmer, we have his context was, and I'm not quite sure without getting emotional in going the parent route of rah, rah, rah. Chris helped me out here. It was a context, some sort of wording. We're not gonna put our name on something for reasons XYZ. And I just wanted to follow up with
mhm.
do you remember what that was, Chris?
Yeah. I'm trying to remember if with Emmer in particular, if it was because of his leadership position, which I know we get a lot. Um, and I remember talking to you about that after, and I'm even going to bring this up later in the presentation that, um, that's something that some legislators will say, and that's a policy that some of them have, that they're not going to co-sponsor legislation that they themselves didn't author, that they're not fully championing, or that is coming through their committee. Their support is still huge. Even if it's not co-sponsorship, especially somebody like Emmer, who is kind of a higher up. I think socializing the bill to him and having him and his staff primarily being aware of the bill um, positions us well, and especially down the road if there's more legislation that comes through. But that is hard to hear, especially when you're a parent and you get this political answer, right? Saying, well, I'm not going to support this. I know you just told me everything and it's all very, um, it's emotional and it's super important, but I'm not going to support it. I get that. That frustrated me when I was on the call with you. But I had heard that before. And Jen, please speak up if you disagree. I still think that talking to them and getting their unofficial support is almost just as important.
Yeah, but how do we go about that? I guess is the question without, because it's easy to want to, and it is leader. He did use the word leadership when you brought that up. His leadership role, and I wanted to throw him under the bus, right? But I kept my cool, just listened. But you
Yeah,
want to follow up and say it's so you don't support our kiddos, um, and that's not the route you want to go.
right.
I think what I might suggest here, Joel, is that sometimes having them not block the bill in their committee is just as important as them um, supporting the bill and or co-sponsoring the
Mm.
bill. You remember last legislative session, it came down to one senator, right? We would have had it hotlined and done had it not been for the one senator. And so I think that's a piece of it too. And one of the questions you can ask is, oh, you can say, I totally understand. And we so appreciate the role you're playing in leadership. We would appreciate anything you can do to help socialize the bill or to help support the bill when it comes through your committee. And that's, leave it at that. It is hard. I mean, goodness, I still cry in some of these calls. It is that close to your heart, and it is your kids, and you are fighting for your family. And it is extremely frustrating when they come back and say, well, no, but I'd almost rather have that than oh yeah, we'll take it under advisement and never turn their camera on kind of situation. So I think there's things you can do, and then just ways to follow up. Hey, thank you for your support of such and such and such bill. People with FASD weren't included in it. We hope that next time they might be, or people with FASD are part of this category of services you just supported. So just keep that communication open, and every no gets us one step closer to a yes.
Okay, thanks. I need to run, but thank you.
You're welcome.
And thanks for bringing that up, Joel. I think that's a great point and something that we run into in other meetings. I know I was in an in-person meeting with Senator Tim Kaine's staffer, and she told us the same exact thing. But Tim Kaine is important. He's on the help committee, so just socializing him to the bill, making sure that he'll not be against it is huge. And Dr. Petrenko, thank you. I noted that you had the same thing happen with Senators Gillibrand and Schumer. Again, two very important senators that by educating them on the bill, just knowing that they will likely vote for it is fantastic. It's really important.
Okay, thank you. I need to run.
Excellent. Thank you, Joel.
Bye, Joel.
Okay, so not everything that happens in the policy world is related to meetings, and it's not all directly related to FASD policy. But as you have noticed from our branding and from this red chair right here, we're trying to give FASD a seat at the table and expand the table and give other people a seat at our table. And to do that, you really have to know what's going on in the disability policy space. And there's been a lot going on in May. Notably, we had the National Council on Disabilities annual meeting happen earlier this month, where they voted on their 2025 policy priorities. So they had members list out what they wanted to be their priorities for the year. In a closed meeting, they all voted on what they had, and they were policy priorities were just released. So the two policy priorities they will be focusing on this year are youth with disabilities residing in nursing homes and policies surrounding autonomous vehicles and how they can be used to support individuals with disabilities. Two other items have been listed as secondary priorities, which are disability policies in the U.S. territories and federal government hiring practices of individuals with disabilities. That one I thought was interesting when listening to it. I was surprised to find out that while the federal government does hire individuals with disabilities at a similar rate to the private sector, retention is much, much, much lower. So I'm not surprised they're looking at that. A couple other topics that were brought up were that will not be prioritized, but I found extremely interesting. Barriers to post-secondary education and disparities in cancer treatment for individuals with disabilities. The NCD, or the National Council on Disabilities, will have to release a report, an update report on this in October. So I'll make sure to detail where they are with their two priority items. Again, the priority items for fiscal year 25 will be youth with disabilities residing in nursing homes and policies surrounding autonomous vehicles. Well, Jen, please feel free to jump in at any time. The autonomous vehicles policy, not much to say about that one, but the youth with disabilities residing in nursing homes seems to be a space where we can fit in, and individuals with FASD could have a voice. Was there anything you wanted to add there, Jenna? Wasn't sure if you had a thinking face on.
Oh no, it was the self-driving cars. I understand that that absolutely would be a priority for those with low vision and those with mobility issues potentially, and but definitely the youth living in assisted care. I do see a lot of out of home placements with individuals with FASD, and we may be able to have some good overlap there and some good conversations around that. So I think I'm really grateful that Chris is looking into these policy priorities so that we have those talking points available.
Yeah, thank you, Jen. And when I post a blog post about this um, policy forum, just to recap, I'm going to include a little bit of a summary of their policy priorities. I sat in on that meeting, and I was heartened to hear the amount of times that hidden or non-apparent disabilities were brought up. So I really do think this is a space that FASD can fit into and should have a voice. Other happenings in May include the Health and Human Services, specifically the Office of Civil Rights, has finalized a rule prohibiting discrimination on the basis of disability. I was shocked to find out that this is something that had to be finalized in 2024, but here we are. This is the first revision like this in about 50 years to this federal code, and it will provide protections for those that are seeking services from over 100 federally funded programs. It will address discrimination in medical treatment that results from stigma, bias, negative stereotypes. It addresses standards for accessible diagnostic equipment. It also has talked about web apps and telehealth accessibility. Notably, it also addresses child welfare programs and barriers that children, parents, caregivers, foster parents might encounter, and will provide access to parenting skills program. One of the reasons I bring this up is because it mentions protections for those seeking services from over 100 federally funded programs. I would be interested to see where FASD fits into this space. I'm going to definitely be keeping an eye on that. But more on that in just a few minutes. As we talked about last month, there was the ICC FASD public meeting. Last month, if Tom was here, I would have him talk about that because that was something he sat in on. But one notable presentation was on women's health across the lifespan, which touched on a lot of information that everyone here already knows, but it is a lot of information that I think our legislators would find useful. The presentation that I'm mentioning was done by Dr. Janine Clayton of the NIH, and she spoke about the first ever White House initiative on women's health research from a couple of years ago, or from last year, which was then quickly followed up by an executive order by President Biden, which called for an investment in women's health research, which included women's health research across the federal research portfolio. So not siloed, it is looking at including women's health research across their portfolio of 11 different federal agencies. And again, I bring this up not because FASD is specific to women's health, but because the way they're going about this is great, honestly. It's taking 11 different federal agencies and making sure that they're all looking at women's health throughout the lifespan, which is something that we would love to see done with FASD across all of our systems of care. And finally, oh, sorry, not finally. There's still two more things notably that happened in May for disability policy. Earlier this month was the first Disability Reproductive Equity Day, which was celebrated at the Capitol, led by Representative Ayanna Pressley. She spoke about the importance of making sure that individuals with disabilities have full control over their bodies and their futures. Again, this was the first time that this was celebrated, and they had a nice little contingency there. And finally, the NIAAA has just as of today released their strategic plan for fiscal years 2024 and 2028. Obviously, we have not had a lot of time to go over that. It came out about 30 minutes before this meeting started. But what is notable is that Dr. Koob reaffirmed the NIAAA's commitment to FASD research, specifically noting the importance of improving diagnostic research. And I do plan to have a blog post on the whole thing out next Tuesday. And we had one other piece of information that is that happened in May. Jen, if you'd like to discuss this a little bit.
Yeah, and apologies for the mouthful of words on the screen. We did submit to the Labor HHS Committee on appropriations outside witness testimony. There will be a hearing coming up, and well, not all of it will be read aloud. This is all given to the legislators in prep for this hearing. And specifically, we asked for an increase of focus and funding for FASD related initiatives, specifically at the CDC. The CDC is now looking at lifespan issues for FASD as opposed to their previous sole focus on prevention and surveillance. And so we specifically talked about that and talked about the integration of FASD into other areas where disability is involved, and funding for that. So that just went out. It went in on Friday. The deadline for it was Friday, so we'll keep you posted with where that goes. But definitely working at being far more active in that space.
Excellent. Thank you very much, Jen. So at this point, people may be wondering why we're detailing all of these different things that are kind of sort of related to FASD that happened in May. And honestly, it's just because they highlight the need for FASD to have a seat at all these different tables and to expand our table. All these are all conversations where it would be and is appropriate for FASD to be included. And even better for FASD voices to be heard. It also highlights that there are really important things happening in the disability space around the country, both at a national and a state level. And now's a good time to act. We can capitalize on this sort of thing. And you can see here we have the question, what's left to do? Well, there's still plenty left to do. With all the developments we just mentioned, those are all great excuses and reasons to reach back out to legislators that you've reached out to before. Or if you haven't reached out to your legislators, now's a great time to do so. Michelle, great question. I can, when I post the, in case you missed it, recap of this, I plan on having the entire subcommittee listed in there, but I'm putting a note down in here and I can give you an email with the Illinois member of that committee.
And I'm just throwing it in the chat right now too, the link to that committee.
Thank you so much.
If you scroll down to the bottom of that page, there's a listing of who the folks are that are on that committee specifically.
That's perfect.
Just to interject here too, one thing that would be really helpful from all of you is many of you are on Facebook groups with other FASD folks. You are in meetings with other folks involved in the FASD community. And we're going to need, as we get towards the end of the year, that big last push and even working up towards the end of the year to get the meetings, really get meetings in, get them going, re-socialize the bill. Even if we've met with people in the past, it doesn't mean that the legislative assistant is still there, right? And so this is where we could really use some help in pushing out the need for additional meetings. And if you know people in those states, one thing Annette Koonsman did that I just got a call out is she was evangelical about I don't know, 7 or 8 states in getting. She was calling family members and having them get so not 7 or 8 states in it, maybe 3 or 4. Yeah. It felt like more. Um, but just if you know people working in this space, living in this space that haven't done that connectivity yet, or maybe haven't done it in 6 months to a year or more, encourage them to do it again. We need that community encouragement because we are going to need to really push as we run up towards the end of the year and into that lame duck to get this done. Um, I know we all don't want to be talking about the FASD Respect Act next year. And it's a foundational piece that we need to get through. So just appreciate any help or support that you all can give there.
Thank you, Jen. Yeah, I'm glad you brought that up because one of the number one piece of advice we've been getting from staffers is to keep socializing the bill, keep talking about the bill, keep setting meetings, because these staffers and their bosses are in meetings all day long. Some have to do with other public health policy. Right now, appropriations is a huge thing. So it might take more than one meeting for the bill to really soak in and for it to kind of rise above everything else that they're listening to. Uh, in that same vein, it's really important that they hear about it from someone other than myself, Jen, Susan, because they work for you. You're essentially their bosses. They're more apt to do, um, you know, something that they hear from you, and that's really crucial. Again, we're happy to be there to talk about the bill itself, but they want to hear from you, which is something that, again, sitting on those Texas meetings last month, it seems that they really appreciate that piece. Going back to something I talked about on the last slide, the importance of making sure that we keep reaching out and socializing this bill. The National Council on Disabilities is made up of 9 different members. 4 of those spots are appointed by Congress. If we want FASD to really have a seat at the table, having somebody involved with FASD part of that council would be huge. And that's not going to happen without raising awareness, raising acceptance, talking about FASD, talking about the FASD Respect Act. So I mean, maybe that's a reach goal, but I don't think it's something that's totally out of reach, essentially.
Well, along that same line, Chris, too, one of the things we've been trying to do is stack as many boards and committees as possible, even if they're advisory committees, with people with living experience of FASD. So the American Association of Pediatrics, we've had, there's a national juvenile justice group that is looking for advisory board members for youth or young adults with disability. So we're trying to publicize as much as possible these national opportunities to sit on boards or sit on councils. Again, just to bring FASD to tables where we haven't had a seat in the past. And raise that awareness piece. So keep your eyes open there. We have not broadcast this publicly, but there is a national board that is looking for a young person, young adult in recovery. And I would love to have a person with FASD as part of this board. It's a key board that is not necessarily related to disability policy, but fits in really well. And it's a paid position as well. So a lot of these advisory committees and boards are paid roles. It's a stipend for participating, but we definitely want to be putting our community forward into these spaces so that we're not missing out on opportunities by not being at the table where the decisions are being made.
Thank you, Jen. Yeah, really critical point there.
And definitely, if you know of a young adult who's in recovery from a substance use disorder who happens to have an FASD or is FASD adjacent, I would really appreciate that referral.
Awesome. Okay, so the second part of this slide, as we've talked about a little bit here, just lists the states that are represented in the House Health Subcommittee. So if you live in one of these states, you can expect an email from me in the next day or two, reaching out to see if you would be willing and able to reach out to the representative. Again, tomorrow when I put out the recap post of this, I'll list out who the actual representatives are. I know Jen put the link in the chat, so you can go ahead and take a look now. But this is a key subcommittee where if we can reach out to them for a couple of reasons, primarily just so once the bill goes into conference, they're all aware of it. There's no opposition to it, and there's as much support as possible. But maybe to get a little intel on, where the bill is now, how everything is going. I think the getting a state proclamation also represents another way to give FASD a seat at the table, but also to stay tapped into state politics, what's going on. It's a good way to get your kind of foot in the door and make first contact, and obviously to raise public awareness of FASD. As I've talked about before, the proclamations for an FASD Awareness Day are ceremonial, not legally binding, but they do have the ability to influence public policy discussions. And I really do think it's a good way to kind of announce yourself on the state level, saying, okay, we're here and we're going to talk about FASD, and we're gonna do it every year until it's no longer FASD awareness, it's FASD acceptance, and it's part of the vernacular, essentially. All of the states listed here have deadlines for proclamation requests coming up in July. So it ranges from July 3rd to July 27th. If you want some information on how to issue an FASD Awareness Month proclamation, you can check this link here. But I would say go ahead and give me a call or email me at melfi@fasdunited.org, and I'll send you over a sheet that is specific to your state that has the contact of who you need to get in touch with. It has the link to submit your requests. It will have draft language if you want that. It'll have resources cited for all of the necessary statistics and everything like that. But we can help you out with that and get the ball rolling. Similarly to the last slide, if you see your state on this list, and you want to be the person that gets these requests in, please reach out, or you can expect an email from me just asking if that's something you'd like to help with. And that brings us to the end of all of our updates. And if you couldn't tell by the amount of times we said it this month, the theme really is trying to expand the table and making sure that FASD has a seat at all these conversations. Again, I'm going to go into way more detail in the blog post about all of the happenings in the disability space over the last month, with suggestions on how you can tailor conversations using that to open up to conversations with your legislators again, which I think is really what we need. As Jen said, we're going to need a policy push going into the next few months, and keeping the FASD Respect Act to what is actively happening is going to play a big role in that. Jen, do you have anything in closing?
Just grateful for everyone here, grateful for the outreach that you're doing and you continue to do, or maybe you haven't done yet, but I know you will. And we really want to be here as a resource, a support, a champion for the work that all of you are doing. And we don't, we know we can't do this alone. So just grateful for all of you being here as our community. any questions on any of the things we covered? Any pressing ideas, suggestions, thoughts? Oh, Chris, you're fabulous. You left them all in stunned silence.
Well, I do want to thank Melissa for adding in what she added here in the chat. Melissa, as always, is doing unbelievable work in Georgia, especially with endorsements, but she's led multiple meetings during the 118th Congress, which is great.
Oh, thank you, Chris. I'm going after Buddy again. As you guys were mentioning, going back after these House and Senators, and I looked in the Health Committee, of course, I was multitasking, and I looked at Buddy Carter, and in May, he and Dingell got together and they are written a resolution for Rosalind Carter. She was one of our first endorsers. So I don't know what's going on in Michigan. I didn't multitask enough to look that up, but Dingell, I guess it is in Michigan. She's a Democrat, and she and Buddy, he's a Republican, and he's on the Health Committee. So thank you for mentioning all that. I probably wouldn't have initiated this again with him because, as you know, it's been a long, hard battle in Georgia.
Yeah.
But I will be touching base with him again. So thank you, you guys.
Excellent. Yeah, let us know what
Melissa.
you need there. And Debbie Dingell, I know I need to reach out to her again. She's very active in the disability, specifically the developmental disability space.
Is she a co-sponsor?
She is not currently a co-sponsor.
She and Buddy, they've written a resolution in May, and it's a press release on his website, and the two of them together, and he's on the Health Committee. Let's get them both on board, right?
And she co-sponsored last ledge session.
Okay,
so,
well,
yep. So we need Michigan.
Her.
Yeah, we need some folks from Michigan to help us out there. So this is where the outreach can be really helpful, and is in having these conversations with other folks in the FASD space and really encouraging them to get out and get the meetings in.
And
you're gonna get Melissa, you're gonna get Buddy. I know it. I know it in my bones because
I don't even know if the staff. I'm not even sure if the staff member is still there. I will check in to see if he is. You know how that went. But we pushed that one hard. But you know, he's with the whole Rosalind Carter, the late Rosalind Carter, and the resolution between. I don't know. I'm hopeful, right?
Yeah. Well, and NAMI too. So. Yeah, I think, and if you haven't checked out who is endorsing the bill recently, I highly suggest you do it. There are some really top tier organizations endorsing the FASD Respect Act, and that's a great reason to reach back out to legislators. You know, let them know who's currently endorsing, because we've got some good ones there. So.
Just looking at the chat again real quick, Kristen, I also think it's very easy to get the proclamations going, especially when the state just lets you submit something right on their website. Really couldn't be easier. It's great. And going back, Julie, I just saw you put your video on, so I kind of want to put you on the spot for a second. You mentioned before that you said, does it average about 3 emails to your legislators in order to get them to fully respond? And I found it to be sometimes more coming from out of the state, coming from us. So I'd be interested to hear what you said that number was.
Yeah, usually I just looked, and it took about 4 emails before I could get an appointment to meet with a lawmaker staff.
And sometimes it takes a letter to the editor.
And
yeah.
I just want to add, if you find yourself in that position where, like Julia, you've reached out 2-3 times and you've got nothing, absolutely let me know. That's when it's very easy for me to give a call to their DC local office and say, hey, I've been trying to get in contact with so-and-so, say the staffer's name. I know a constituent has also reached out, but we haven't got anything on the schedule yet. Can you help me? And that person on the phone, I mean, this has worked probably a dozen times with other people. So please feel free.
Yeah, I would say a letter to the editor is a last resort. But it did
Yeah.
get a quick response.
The other thing I might mention is that, staff changes frequently. So it's possible to send an email thinking that you have the current staff member only to learn that they've moved on and you should target a different staff member.
Yeah, that's a good point. That's a good point. And if you're lucky, they'll leave a trail. They'll say, please direct all emails related to this person, but you're not always that lucky.
They usually don't. So then you're hunting them down again. Yeah.
Yeah. Um, Michelle, yeah, in your state, in Illinois, you have to be a nonprofit. Okay, so I've seen that in quite a few states, and not all states will say if those nonprofits have to be within the state. So the individual who's sponsoring it should be from the state, and then maybe the nonprofit they partner with could be national. So let me look at that for Illinois specifically, and I can get back to you about that because it could be a thing where we're submitting with you attached as the local.
Or the other option is to check if there's an affiliate in the state too, because they predominantly are nonprofits or state agencies, universities. And that might be another way of getting that done. And I mean, the nice thing about the state proclamations too is that if you are in your community trying to build community and trying to get people to do things in support of FASD, say you've got a group of families, the typically speaking, getting the resolution done or getting the proclamation done, that can be something that you hand off to somebody who's maybe kind of newer to advocacy. Because we've got templates, we've got guidance. You literally have to follow the process, and it's done. There's not a lot of guesswork to it. So it's a great way of getting other people involved in this work.